So it's a pleasure for me to have with us today Aggeliki Gkouziouta, who is a cardiologist, attending physician at the Onassis Cardiac Surgery Center here in Athens. And Aggeliki, yesterday we already heard the voice of the general manager of this important organization in Athens, and who gave us the view of what does it mean to embrace an innovative project like the one proposed by retention from a managerial point of view. But now it would be very nice to listen to your voice and what does it mean for a clinician to be involved in this innovative approach to care and cure, somehow supported by technology on one side, and what do you think should be the main benefits for the patients that will be engaged in this venture?
Well, advanced heart failure is a complex condition, and unfortunately, those patients that are in advanced heart failure or are supported with VADs or have finished their journey and they are already transplanted have great demands in terms of admission and follow-up, especially the heart failure patients need to be admitted frequently due to congestion and due to other issues. So in terms of follow-up, of a remote follow-up, it is very important for the clinician to detect the problems that may arise before the patient arrives in the emergency department or needs a hospitalization. So with this project, we aim to reduce the rate of the urgent hospitalizations and also the need for the patients to visit the emergency department. So the clinicians will have all these tools in order to follow the patients remotely and to detect conditions that may be that may be faced at home with the need of drugs or with other advices. And this is very important because we will reduce the rate of hospitalizations that is very high for this sensitive population.
Thank you. This sensitive population is mostly composed by elderly people, not just elderly people, obviously, but I mean, a good rate is represented by elderly. Do you think that using the technology for them could be complicated? Do you see some obstacles there in accepting, let's say, the therapies or the clinical protocol, let's say, proposed?
We don't see any obstacles because we tried to make the platform easy for the patients because the majority of them, I mean all of them, have a mobile at home. And even though that they don't have a supportive environment, they are helped either by other institutions or they use their application. So this kind of population takes the vital signs every day, like measuring the blood pressure, measuring the saturation, weighing their body weight. So it won't be difficult to apply with the platform or asking for help in order to see the application in the phone. So our aim when we tried to design the platform was to make it as easy and as friendly for the user possible.
So that's really good news. By the way, in the retention project, you have a very important role because you are a principal investigator and you're also managing the other clinical centers that are participating to this trial, to this clinical trial. They are belonging to the very different places in Europe, and you see huge differences between the 4 clinical centers involved in retention, or do you think that quite a common approach can be used by all of them?
Well, my hospital, the Onassis Cardiac Surgery Center, has the role of the clinical coordinator in this study. So we didn't face any problems regarding how we treat the patients because all the centers that they participate in this trial are pioneers in their field, in our field of treating advanced heart failure patients, ventricular assist device patients, and heart transplanted patients. We faced a lot of problems regarding issues like the ethics applications and legal issues that are different between countries. But now we are in a phase of this project that we have overcome all these problems with the cost of a little bit of delay. We had a little bit of delay of the kicking off the trial due to the COVID period, because this was designed during the hard times of COVID pandemic. And then we had to overcome some ethics issues that were different between the countries. And the other issue that we had to face were like the purchasing of the device that are going to be used by the patients, because in every country they had different prices, and they had also different rules in the acquisition of the devices. All the rest went smoothly, and we don't face any more inequalities in this project.
So let's wish that there will be, let's say, in the future, a more alignment in terms of regulation and even procurements, no rules to standardize a bit the procedures. This will make maybe life easier in this kind of international collaboration in related to clinical approach to new therapies or new treatment. Just to close, when do you believe that finally the recruitment of patients and the real start of clinical activities can start?
Well, the aim of this fifth plenary meeting of the retention trial was to resolve these issues. And today, I'm glad because we are throwing this interview today. We are very close. We believe that by the end of the year, all the centers will have the application from their. They will have the approval from their ethics committee. So by the first months of this year, January or February, we will start the recruitment of our patients.
How many patients in total will be recruited?
They will be recruited in total 450 patients, advanced heart failure patients, ventricular assist device patients, and transplanted patients. And we aim to recruit the 35% of those patients will be women, because as we all know, unfortunately, women are not represented well in trials and in European projects.
Thank you so much, Aggeliki. So we will come back to you early next year to have some updates about this fantastic initiative supported by the European Commission.
Thank you.
Thank you.